All right, welcome everybody to the 2022 PI conference. We're going to get started in just a moment. My name is Emma Mertens and I'm the Program Manager of Community Relations at IDF, and I will be your moderator for this education event. Today, Dr. Barbara Biesecker will be presenting on the topic of genetic testing and genetic counseling. There will be time for questions at the end of the presentation. Please submit any questions you have to the presenter in the Q&A section of the platform. Barbara Biesecker is a distinguished fellow in the Genomics, Bioinformatics, and Translation Center. Her expertise is in social and behavioral research in genomics, with interest in communicating uncertainties and facilitating informed decisions among stakeholders. Dr. Biesecker has a 35-year career in genetic counseling clinical care, graduate education, and research. Her major publications contribute evidence on the psychological, social, and health outcomes of living with a genetic condition or at genetic risk, and the translation of genomics into clinical care. Welcome, Dr. Biesecker.
Thank you so much, Emma. It's an honor to be here, and I look forward to hearing what some of the questions are at the end of my talk. I encourage you to submit them. I'd be more than happy to address them. So I do not have a lifetime of experience as a genetic counselor working with immune deficiencies, and I want to be very upfront about that. But at RTI, which is a nonprofit research institute where I work, we were very fortunate to partner with SCID Compass in order to do some research that we've now submitted for publication. Looks like it will be published on living with uncertainties after a SCID diagnosis from newborn screening. So I became much more interested in these conditions and what families go through. I'm going to talk broadly about this topic of both genetic counseling and genetic testing. Apparently, this was asked for so that people wanted to have a better understanding about what these two things are and how they may intersect. Next slide. I can't advance the slides when I hit forward.
You have to advance them from your end, Barb.
I am advancing them from my end and they're not going.
One second, Barb. All right, give us 1 second, everybody. We're having some technical difficulties. Barb, I'm going to share them from my end. Just give me 1 sec. All right, Barb, I'll just share them on my end. You should be good to go.
Okay, I can't see them though. Okay, I can see them again. All right, next slide. Can you advance them?
Yep, hold on. I'm having issues.
Okay, sorry.
1 sec. Sorry, everybody. Can you see them, Barb?
Yes, thank you.
Okay.
So I'm going to start with a very sort of academic description of what genetic counselors are, and then I'll get into more details about some of the work that we do. And so give you more of an idea of what our involvement is with families. So genetic counselors are master's trained professionals with expertise in both genetics and counseling skills. Can we go back? Thanks. And that's an interesting combination because you need to have a very basic biology understanding in order to learn genetics in a way that you can explain it to other people and you understand how it plays a role in the development of various conditions. And counseling skills requires some psychological skills in understanding what other people are experiencing. So it's a really interesting and I think fascinating profession that it includes both the basic science and then how that basic science affects people's lives. The formal training for genetic counseling has existed for 50 years or so in the United States, and there's currently over 55 master's programs. We had a big explosion of them in recent years when there was predictions that there was going to be an expanded need of genetic counselors in the United States. After graduating from one of the training programs, genetic counselors can be certified by the Accreditation Council for Genetic Counseling, which is sometimes required in states that have licensure for genetic counselors. Next slide. The primary objectives of genetic counseling is a much more interesting part than just how we're trained. And that's to convey the meaning of genetic information to promote understanding. So what I mean by that is we want to help our patients and their family members understand information within the context of their own values and beliefs. In other words, we're not trying to teach them to become scientists. We're trying to help them understand information so that it's useful for them. It answers their questions, and it allows them to be empowered to have the knowledge that they're seeking. Genetic counseling is often described as a non-directive approach. And that's because we're trying to foster these opportunities for patients to make their own informed choices rather than direct them in a particular way, unless the testing would potentially be life-saving. And in that case, we're going to act much more like a physician or a nurse might act in making a recommendation that people undergo testing. So the genetic counselor needs to understand the patients. Sometimes I call them clients because not everybody we see has a condition. So patient or client's needs and their preferences, and provide help on how to think about and work through the genetic information in terms of what it means for them. It will be perceived by people in very different ways, and we can't anticipate what those things are because we haven't lived in their shoes. So we work hard to help make sure that people get information in a way that makes sense to them. So ideally, this is accomplished in a way that empowers the person, fosters their autonomy, meaning that they can then use that information to affect their own outcomes, and evokes their competency, which means makes them feel more competent in working in the space around their condition or their risk. It requires the counselor to keep the other person and their inner experiences at the front of their mind. And by that, I mean, we have to sort of set aside our own issues, thoughts, and feelings when we're interacting with our clients or patients, because we want to be thinking about and relating to what they're telling us. Next slide, please. There is a psychologist who was trained in genetics named Dr. Seymour Kessler, who was one of the original genetic counselors in the United States. And he proposed that there are two models of genetic counseling. And obviously, life is usually more complicated than just one or two choices. But he divides them into the teaching model and the counseling model. And he does this in order to declare the difference between these two approaches in a way that might help people understand what the difference is. So a teaching model makes the assumption that human behavior is understood through an analytical lens. And what he means by that is that if people have the information, then they can use it to their effect. It's very sort of concrete. It integrates evidence. Oops, can we go back to the teaching model? Thanks. There's less evidence of the effectiveness of the teaching model than there is the counseling model. So we don't have a whole history of experience that if we give information and all the facts to people, that's sufficient. It also results in a bit of what can be considered an authoritative approach, meaning that if the genetic counselor is teaching, they're the ones who have the information, and it's not empowering the patient for them to teach them as though they were students. So what we're trying to do in the counseling model, next slide, please, is to do something that is more mutual. So the counseling model makes assumptions about human behavior as though it were understood through a psychological lens rather than an information lens. So it does integrate evidence-based approaches. So there is some scientific validity to a counseling model, and it aims for mutuality. And what that means is that there is more of a mutual exchange between the patient and the counselor, so that both gain from the experience. Next slide, please. The counseling model is based on the perception that clients seek out counseling for a lot of different reasons. It's mostly assumed that people seek out a genetic counselor because they want more information about their risk or about their condition, but it goes beyond information itself. Information is not that hard to access these days with the internet. And so the complexity of this is that it's information that affects them. So it's more important to think about what their understanding is of that information and how it presents itself in their life. It's also important to find out where people are seeking support for living at risk. Can we go back, please? And where they're looking for validation of their current feelings and their current concerns. So that this interaction, as you can start to see, is more than just an exchange of information, but an understanding of what people are living with and what uncertainties they're facing, what challenges they're facing, how to validate the efforts that they're already making to help themselves and reduce the level of anxiety that they may have that's based on the fact that they don't have enough information, and empowering them with skills to be able to help themselves. People always come in with some of those skills, but they may not be feeling like they're accessing them as they would like to. Next slide, please. So the goals of the counseling model in genetic counseling is to understand the client. What are his or her circumstances? What does he or she think about them? How are they feeling about them at this particular point in time? So the beginning of counseling often starts with a lot of question asking, so that the counselor is not likely to make assumptions that this client is somehow going to be similar to ones that you've seen in the past. You always want to start with a clean slate and figure out who the person is who's in front of you. So we want to help promote a greater sense of control in one's life that begins by facilitating the opportunity for the client or patient to have some control over the genetic counseling session. So that usually means it's a two-way street where the patient is able to ask questions, to talk about how they're feeling or how they're thinking about things at the time, and to have ownership over the exchange that's taking place. It's about what the client wants and needs, rather than what the genetic counselor assumes they need to hear about their condition. That's a very sterile way of approaching this because it doesn't take into account the experiences that the patient has already had. We also want to find out if they're coming with specific problems that they want help in addressing. And if people have things that they can't make decisions about yet, they may be looking for guidance or solutions. And the way we tend to approach this is to help clients walk through what solutions they've entertained so far, thought about, discussed in their family, and how did those resonate with them? Did they sound like they would work or they wouldn't work? And walk them through a process that gets them closer to solving problems they bring up that's in accordance with their own values and beliefs and their family priorities, so that we don't impose our own biases in that problem-solving process. And the hope is that by going through that with people, we can reduce some of the distress that they're experiencing at the time that we meet with them. In addition to that, there can be more positive outcomes like supporting them so that they don't feel alone at that particular point in time, and to help them recognize that there are ways that they feel good about themselves and they feel like they have been successful in helping themselves, even if they are facing some current problems. And doing that can help raise somebody's self-esteem a little bit, or bolster their competence, their inner competence, their ability to be able to solve the next problem a little easier because of the process that you've been through with them together. And to be very concrete about it, much of the time we're trying to help them find ways to cope effectively with a health threat or a new diagnosis. So those are some of the goals of genetic counseling. Next slide, please. So genetic counselors who practice with the counseling model rather than the teaching model align with the client's concerns. So they might say something to a patient like, so you're currently facing some disturbing news. I'd like to hear your thoughts and feelings so that we can find a way forward. So if a counselor says this with genuine concern, this is an approach that can be experienced by the client as being empathic. Empathic's kind of a complicated word. I think people interpret it a lot differently, but here what I mean by it is walking around in somebody else's shoes and getting a sense of what they're experiencing, even though they couldn't possibly ever really understand it because they're not experiencing it themselves. So it's sort of trying to learn what somebody else's life experience is like in a way that you can help them. And these kinds of efforts can establish a presence of being there to help the client through what might be a very difficult circumstance or decision. And it can be described as a process of joining with the client. Next slide, please. So the strength of the counseling model of genetic counseling resides in dealing with the personal and interpersonal issues. So both what's going on inside of you and maybe what's also going on between you and your partner or you and your child, these issues can be addressed as well. So the subjective meaning of information that I mentioned earlier in the talk is very important, which means how the patient is thinking about the information and what it means for them is far more important than how the counselor thinks about that information. And it's important for decision-making and to maintain a non-directive approach so that the client feels empowered to make their own decisions. It does require very deliberate effort by the genetic counselor. It's based on understanding another person and providing help on how to think about and work through life problems. This is accomplished in a way that empowers the person, fosters their autonomy, i.e., their ability to take care of their own challenges, and evokes their competency. So it helps them recognize that they have the inner strengths to go forward. It requires the counselor keeping the other person and their inner world in their mental foreground. And that sounds like a lot of fancy words, but what it means is you can't be thinking about yourself or what you would do in their situation, because that's irrelevant, because you are not them and you can never fully understand what their experience is. So you want to keep yourself as the counselor out of the session as much as you possibly can and focus on trying to understand from the client or patient's perspective what their inner world is like and what circumstances they're living with in order to help them make a decision that's right for them. It also, and so I'm being redundant here, but it requires that the counselor suppresses their own needs for the sake of somebody else. And these issues were published by Dr. Kessler. Next slide, please. So when you encounter a genetic counselor, if you do, I really encourage you to form a partnership with a counselor. I would really encourage you to be active, such as starting with asking for information you may be seeking, therefore letting the counselor know what's most important to you. And if the information that you're learning is difficult to understand, because a lot of science language in genetics and other sciences as well is hard to understand. And it can be very jargony. There's a lot of scientific terms that geneticists and genetic counselors and even immunologists all get very comfortable with, because we have been trained in that, and that's kind of the language of our profession. But that doesn't mean it conveys information that's useful to the patients that we're working with. So if the information is not clear and understandable, please ask questions and ask for support where you may need it. I think a lot of patients, because of their pride and their general ability to manage their circumstance, they feel that they shouldn't show their weaknesses or ask other people for help because they're in charge of their own life. But if you share your thoughts and feelings, if you feel safe in the relationship with the counselor, you can receive validation of who you are and what your resources are that you've demonstrated to the counselor, and it can help you feel better about challenging circumstances. Discussing your thoughts and feelings can cause anxiety for sure, because you're talking to somebody who you may not have met before, but a counselor who joins with you can help to ease that anxiety to some extent. And when you engage and you feel valued by the counselor and respected, it can enhance feelings of your empowerment. So this is a two-way street. It's a partnership. And I think you can contribute things that can maximize that experience with a genetic counselor. Next slide, please. So I'm going to leave the genetic counseling discussion behind for now and now talk about genetic testing. It is true that genetic counselors frequently offer and explain genetic testing in a variety of different healthcare settings. So testing may be screening or targeted testing. Screening means testing a population not known generally to be at increased risk to identify people who are at risk. And targeted testing generally means testing people who are at increased risk and much more likely to be found to be positive if they are offered testing. So more and more screening testing is going on, and people in the IDF community are probably most familiar with newborn screening, which has been started specifically for SCID in the primary immune deficiency arena in order to detect these disorders early on for the opportunity for targeted treatments very early in life. So in genetic testing, the intention is to help patients make informed decisions. Oh, can you go back or forward? I'm not sure where we are. There we go. Yeah, testing may be, the intention is to help people make informed decisions when testing is optional. So genetic counselors do encounter a lot of genetic testing discussions where people may or may not want the testing. There's no medical indication for it. And in that case, we really want people to understand what their choices are and to make sure not only they have information that's relevant, but that they also consider their own values and beliefs about how that information may be useful to their family. And when we do help people undergo testing that may be medically indicated for confirming a diagnosis and treatment, and obviously in an immune deficiency situation might actually improve their ability to be healthy and stay alive, then you will see genetic counselors be more assertive about testing that may be medically indicated. Next slide, please. So who can order genetic testing? This is a very complicated question because genetic counselors are often the ones who present the information and offer the testing, but a physician must actually place the testing order. So genetic counselors don't order genetic tests. They can help interpret the results. And they can also describe the process and help facilitate the decision-making process. And then a physician orders the test. I reviewed a review on testing for primary immunodeficiency patients, and the evidence suggests that it's the immunogeneticists who most often order the testing, but they often consult with a geneticist because the immunologist can identify the features of the disorder and describe them, and the geneticist can then guide the immunologist to the testing that would be potentially most fruitful for those findings. And increasingly, there are descriptors of immunogeneticists who have the expertise in both areas. Next slide, please. So I think I just all told you this whole slide. So most often immunologists identify the deficiencies and order genetic testing, often with consultation. And identifying the specific gene that causes the condition is important to understand how it's passed on in a family. It may be the first case of an immune deficiency in the family, or it may be the first time a cause is found for something that has been in the family. And family members can get tested to learn whether they carry the same gene variant. This type of family testing can lead to treatments and/or informed decision-making about future risks. So this is an interesting circumstance. If you think back on the types of genetic testing that I was talking about, the use of genetic testing to make decisions about future pregnancies is an optional use of genetic testing, and it's your privilege to use it if that's helpful to you. Whereas testing to confirm a diagnosis and identify an appropriate treatment can be a life-saving reason for undergoing genetic testing. So both are true, and they're quite different, actually. Next slide, please. The ordering and discussing of genetic testing happens in a lot of different ways. So because an immunologist is the most likely to identify the signs of a disorder, the immunologist may defer to a geneticist, I've already said that, to order specific genetic testing, or may know plenty much about it that they don't need the geneticist's input. But they'll have a suspected diagnosis based on the identified findings that they're trying to confirm with the genetic testing. Often then a genetic counselor may get involved in this process and will take a family history to identify, based on the pattern of inheritance, who else in the family may be at risk, if anyone. And the genetic counselor may or may not be the professional who returns testing results to the family and discusses their implications. So genetic counselors and geneticists may work directly with immunologists, and for the care of people with immune disorders, I think this happens pretty fluidly. And so people have overlapping tasks to some degree, but hopefully this gives you a little bit of a better idea of what's somewhat unique to the various ways people are trained. Next slide, please. So patients with hereditary immunodeficiencies are well served in specialty clinics, and those clinics often include immunogeneticists or immunologists and geneticists and genetic counselors. These teams can identify the symptoms and order appropriate genetic testing that can often lead to identification of a specific cause of the condition and the course of treatment that's recommended. They also offer the opportunity to review the information with a genetic counselor, have an opportunity to ask questions, obtain some support, and learn about resources. Next slide. So obviously PID is a important, sorry, that's not what I meant to say. IDF is an important resource for patients with PID. And obviously that's why I'm giving this talk at a conference of IDF. But NIAID is a research institute, allergy and infectious disease at the National Institutes of Health, which is a research institute. And not all patients with PID qualify to participate in current ongoing research studies because the research questions change, and the criteria by which people are eligible changes over time. But it's an important resource for learning about what research studies are going on. And the genetic counselors who work in that environment, and there are several of them. Oops, I lost my slide. Anyway, I was saying that the genetic counselors who are at the NIAID are available for helping guide people toward resources and answering questions. So I'll stop there, and then I think it's time for questions.
All right, sorry about that, everyone. For some reason, my video is not working, but that was your last slide, Barb. So that worked out well. All right, so before we get into Q&A, we just want to thank Dr. Biesecker for that wonderful presentation and for explaining the differences between genetic testing and genetic counseling, and the importance of both for our PI community. So before we get into Q&A, we just want to restate that everyone's treatment and condition is different and unique, and the information during the session is not medical advice, nor is it intended to be a substitute for medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with questions concerning a medical condition. All right, so we've got some great questions lined up, and we have our first one. All right, Barb, should someone with genetic testing have genetic testing done semi-regularly? Or I'm sorry, should someone with a genetic condition have genetic testing done semi-regularly, such as every 5 to 10 years, since the science is always changing and learning?
Great question. I don't think there is a formal recommendation for a timing when you might get future testing, but it is true that for a number of conditions, if the testing wasn't informative the first time, over time, it is worth revisiting that and potentially pursuing genetic testing again. So I would say that that's an important opportunity to touch base with an immunologist who knows genetics or a geneticist in order for them to give you an idea of how much the interpretation of the variants in that gene has advanced. Because if it hasn't changed at all, it's not worth getting tested again. And if it has changed and there are more opportunities to identify variants that could cause the disease, then it would be a reasonable thing to pursue. So you could also just tap into a genetic counselor who works with immune deficiencies, and they would be able to guide you on that question. But it's a great question to raise because certainly things are changing.
Thank you so much. All right, next question. How do you counsel someone with an identified or suspected genetic defect, but still unclear significance? So I guess they suspect that they have a genetic defect, but it's not yet known.
Yeah, so our job isn't a diagnostic one, right? So if they suspect they have a condition and they're grappling with it, that would be no different for us than somebody who had a confirmed diagnosis, other than we wouldn't be able to tell them how it was inherited if we don't know what it is or what the risks are to family members. On the other hand, living with something that's challenging and difficult is part of what genetic counseling is, and we could help to support people and make sure they have access to resources and plans for continuing to get assessments at reasonable periods of time. I would say genetic counseling could even be interpreted as more important in that circumstance, but with the caveat that we're not the ones who are going to resolve the lack of a diagnosis.
Thank you. All right, next question. This individual asks, none of my doctors, including my immunologist, they're from New York City, works with a genetic counselor or utilizes genetic testing. How do I get/find a genetic counselor?
Great question. Well, there's the National Society of Genetic Counselors, where you can look up a genetic counselor who's in the New York City area. I can't imagine you can't find one in New York City. You might just be in New York and not in New York City. And I would wonder about just IDF, if there is a directory of providers who are available that you guys might have access to who is there. And if you can't find anybody, you can literally contact me and I will do my best to connect you to NIAID, who might know of a counselor who works there.
Well, thank you. All right. And certainly IDF does have a clinician finder, and we are trying to broaden our base of the types of clinicians that are included to include additional folks, not just immunologists, but other individuals who contribute to the care of the PI population. So we'll work on trying to get some genetic counselors in there. All right, next question. So this is slightly diagnosis specific, but I think you can still probably address it. This individual says, I'm 67, diagnosed in my 40s with CVID. No children. My nephew and his wife just had a baby. What genetic testing should I have done to see if my CVID genes have passed on? Where and how do my doctor and I get started?
I would say your physician should contact a geneticist and have a conversation about, I don't know if the patient's testing revealed a pathogenic variant in a gene that caused the disorder. That would need to be known. If it has been identified, testing may be possible. I'm not sure it's indicated because I don't know what the mode of inheritance is for her specific variant. But certainly I would encourage her to ask those questions of her provider with the help of a geneticist or a genetic counselor.
Thank you. All right, next question. I ordered an at-home genetic testing kit through, I think it's pronounced Invitae.
Yep.
I got access to my results, but how do I have them interpreted? Can I bring these results to a genetic counselor?
Great question. Invitae usually flags abnormal results on their reports, but if that's not obvious, you absolutely can bring it to a genetic counselor.
Wonderful, thank you. Next question. My whole family did 23andMe kits for Christmas last year. Can I bring these results to a genetic counselor to discuss, or is this not the same as a regular genetic test through my provider?
Yeah, that would not be the same.
Thank you. All right, next question. Can a physician do genetic testing without a patient's consent or knowledge?
Not ethically. Yes, no, genetic testing is something that you have to physically do things in order to be tested. It used to be, we used to draw blood for testing, and now we use spit samples. So you just have to spit into a tube. So it's not invasive, but yes, you have to have informed consent to get a sample of somebody's DNA that you're going to analyze.
Thank you. And it looks like this is our last question for this session. Are there disadvantages to being tested as far as insurance and labeling?
Oh, that's a great question. Well, money is one reason. That's a disadvantage. Testing is expensive, and your insurance may not cover the whole thing. It often doesn't. So that is a deterrent. If testing you need to work with your immunologist about this, but if testing would offer a more effective targeted treatment, that's the benefit you're weighing against the cost. You have to make an informed decision with your provider about whether it's worth it. But yes, it can be expensive, and it can be not fully covered by your insurance. And what was the rest of the question?
They asked as far as insurance and labeling.
Labeling, yeah. I don't know about labeling. That's a good question. If you were found, if it describes your immune deficiency and they give you a name for it, I don't know if that makes you significantly more vulnerable than just having the symptoms, known symptoms of an immune deficiency. Because even if you don't have a label, you can't say you have no illness because you know you have something going on, right? I don't know that giving it a name makes you more vulnerable. I'm not certain about that. But definitely the testing process can, because once you know something about yourself that's specific, if an insurance company asks you to reveal anything you've been tested for that was positive, you can't lie. Yeah.
All right, thank you so much. It looks like that's all of our questions. So thank you everyone for your participation and engagement. Thank you so much, Barb, for this wonderful presentation. We really appreciate it. And this marks the end of this session. So thank you very much, Dr. Biesecker. It's been such an honor to have you join us today. We really appreciate your time and expertise, and I hope everyone in our audience got a lot out of this session. So thank you so much, and we hope you all enjoy the rest of the conference. Thank you. Take care.
Thank you so much. It was my pleasure.